registered physiotherapist. Today I'd like to talk about a technique that I use to decipher between two different conditions that can in a lot of ways present in a very similar fashion. And what that is a hamstring strain versus some form of sciatica or disc type issue in which a patient might be actually having peripheral symptoms or symptoms down their leg that actually goes into the hamstring area, but is not actually a result of anything going on from a muscular perspective in terms of a strain of that particular muscle. I see quite a few patients coming in who they'll comment to me about, you know, I've had this sort of nagging discomfort in the back of my leg here. I've had it for months, and you know, it just doesn't seem to want to go away. I try stretching it, I do some self-massaging through there, I'm trying to strengthen it, but it just doesn't want to get better. It's not improving whatsoever. What's going on here? And a lot of times, as I mentioned, symptoms of a hamstring strain in a lot of ways will actually have a very similar presentation to sciatic-like symptoms. And so essentially when I'm talking about sciatica, essentially what's going on there is there's a compression of either a nerve or a peripheral nerve, essentially the sciatic nerve, which runs down the leg in a similar pattern to where that hamstring muscle is. So in a lot of cases with these particular patients, they'll complain about buttock pain that again refers down the leg into and around that hamstring area. And so the reason it's so important to decipher if this is muscular or nerve related is because the way that one would treat one versus the other is completely different. And in a lot of cases, when I see patients who actually have some kind of nerve compression, but they think it's a hamstring strain of some type, they're actually provoking their symptoms in a lot of cases, and that's why really they're not getting any better. So I want to show you a bit of a technique that I sometimes will use to try and decipher between the two. And essentially there's a test, it's called a slump test, and what we have patients do is essentially sit in a position like this, slump down, so their head is down, their lower back is completely slumped, and then I'll actually have the patient extend out their leg in this position here. And a lot of cases, what'll happen is if there's some form of issue in terms of nerve compression, this particular movement will provoke their symptoms. Now, the way that the thing is that same particular movement can also provoke a hamstring strain. Now, here's the difference. When I'm in a slump position like this, I'm actually putting more tension in through the nervous system, and then when I add in that extension in through the leg, I'm essentially tightening up that whole nervous system, right from the nerve root out of the lower back all the way down the peripheral nerves. So the way that you can decipher in terms of this test if it's to some degree more nerve or hamstring is I'll actually have the patient then do the exact same test, except now in a fully in terms of their lower back being fully extended, right? So now I'm actually slackening, you can think of it, the lower back or the nervous system or the tension in those nerve roots coming from the lower back, and I'm going to have the patient now try to extend the leg again. Now, if the symptoms are still reproduced, that is that there's still pain, there's still discomfort down the leg, there's a greater likelihood that this is muscular versus if they, after I take them out of this slump position, if they're coming up and let's say they regain more range in the leg, or they're actually not, again, provoking those symptoms, it's pretty safe to assume that in that case, it's actually coming more from the lower back, so more of a sciatica-like symptom versus a muscular issue within the hamstring. So it's one of the techniques that I sometimes use in terms of deciphering between the two, and it's something that I really, when I'm speaking with patients or about their symptoms, I really have to determine, you know, is this muscular or is this coming more from, again, the nervous system, because the treatment is completely different. In a lot of cases, patients that are actually stretching their hamstring and thinking that they're actually doing some good in terms of if they think it's a hamstring strain, are actually making their symptoms worse, because that particular position in a lot of cases will aggravate their sciatic symptoms. So if you have any questions, concerns at all, please feel free to leave some comments below. And I really appreciate you watching my video, and thanks so much.